Hi, my name's Sammy Kadak. I'm a women's health physiotherapist and I work particularly with women during pregnancy and postpartum. I'm currently almost 38 weeks pregnant and I wanted to go through a few tips of how to sit on various chairs in case you're getting any back pain, pelvic pain, or wanting to help improve the position of baby within the abdomen and the pelvis in preparation for birth. So the type of chair that you're sitting on will make a difference, but you can still adjust yourself on that chair to give yourself the best chance of having a more neutral pelvic position, which in turn will help to relieve pubic symphysis pain, tailbone pain, lower back and SIJ pain. And when you're in more of a neutral pelvis, slightly tilted forward position, as opposed to tilted back, that's going to help encourage your baby to be more occiput anterior, which means that they are facing towards your spine as opposed to posterior, where they might be facing forwards instead. And that occiput anterior position can lead to more smoother progress through labor and an easier birth. The pelvic position we are aiming for is what I think of as a neutral pelvis. So you could exaggerate and explore where neutral feels for you. But if you were to tilt your pelvis forward and really rock it towards the front of your body, that's going to be a more anterior tilted pelvis or forward tilt. You could also experiment and go the other way, and you can see that rounding of my spine. This is a more backward tilt or a posterior pelvic tilt. And we want to find somewhere that's comfortable for you in the middle. Another way to find that neutral position is to slide your hands under your bum and find where your sit bones are. So if you wiggle around a little bit, you'll feel the bony parts of your pelvis. If you've ever had somebody sit on your lap and you've thought, oh my gosh, you have a bony bum, those are the bones that we're looking for. And that is where you want the pressure on those sit bones, really underneath your pelvis, as opposed to on your tailbone. The more that you are tilted back, the more baby is inclined to roll and end up in that posterior position or that sunny side up where they're facing forward. So if we can encourage more neutral sitting posture, that is going to be more comfortable, relieving the soreness on your pubic bone, your tailbone, pelvic girdle, and back pain, as well as facilitating baby's position. So I find, if in doubt, or if you can't find any alternative for your chair, if you sit on the front edge of your seat, it is much easier to find that neutral pelvic position compared to if you're sitting a bit further back or all the way back in the seat. And you can see how the shape of my spine changes, and now that pressure is much more on my tailbone compared to the sit bones. So sitting on the front edge will always be an easy change without any extra bolsters or towels or pillows. There are some seats where you can adjust the seat itself, so potentially an office chair or in your car seat, where you might be able to have a look at the chair and see, does the seat pan actually slope backwards? And can you adjust it and change the angle to make it at least flat or even with a slight forward tilt? And bringing the backrest up then to meet you rather than you having to lean back to get to it when you're sitting all the way back. The other way to adjust is with some towels or a cushion. So I have a few props here. Now this is a pretty unique chair, but you'll see that it does rise a little in the middle and then it slopes towards the back, which is what most couches, most car seats and office chairs will do. They will slope backwards, really tipping you into that posterior pelvic tilt. So if you have a chair like that, I would encourage getting a small blanket, a towel, hand towel, depends how much support you need. But by placing that at the back of the seat and filling up that gap so that you've got a slight gradient from the back down towards the front, or at least flat, that is going to make it much more doable to maintain that neutral pelvic position without much extra effort. If you need a little something behind your back as well, then you could add a little lumbar roll and adjust the thickness and the height of that to find as much comfort, especially if you're going to be sitting there for a while. Now, while pelvic position and good sitting posture is really helpful, really one of the best things you can be doing if you do have to sit for a long time, whether it's sitting for work or if you're sitting to watch a movie or something, really is just to change position and get up as frequently as you can. So whether that's working in some of the hip opener stretches that I've gone through, maybe going into some glute stretches while you're sitting and shifting up, whether you're sitting at the front and the back of the chair, crossing one leg, crossing the other. We do want to have symmetry as much as possible to encourage babe to find their position that they need to be in. And having the knees a little lower than the hips will also give baby a little bit more space to find that optimal fetal position ready for birth. So I hope that's been helpful. Please leave me any questions or comments below. And remember, you can adjust your seat by adding some props, figuring out where feels best for you to sit on your chair, and then finding that neutral pelvic position.